All right, welcome everyone. Thank you for joining. If you are here for the PPMD Access webinar, you are in the right place. We will get started in just a moment. All right, looks like we've got some people filtering in. We'll wait for these numbers to level off before we get started. All right, looks like our numbers are starting to level off. So I think that we can go ahead and dive on in. Thank you everyone for joining us today. We're really glad that you're here joining us to talk about advocating for access, navigating approved therapies in Duchenne. We've got a really great group of speakers today to dive into the topic of access to approved therapies. It's clearly been a really exciting couple of months in the world of Duchenne with the recent Elevidys approval. And we recognize that you probably have gobs of questions about what that means, how to navigate your resources, your insurance, work with your clinic team to get approval and ultimately access to therapy. And so we really just want to come together and start the conversation. And we look forward to really digging into the ways that PPMD is partnering with the community to advocate for access. So I'm going to go ahead and pull up my screen. We've got a few slides to share, and hopefully I can make my slides work for everyone. So a little bit of what to expect today. We're going to go through who are the team members that are advocating for you, both at PPMD and with our partner organizations. We're going to talk a little bit about what's the overarching plan, what's the strategy, how do we work as a team to promote access. We're going to talk a little bit about some of the resources that we have available, how are we partnering with our community, how clinic teams are so critical to supporting access, and what case management looks like and what to expect if you utilize some of those services that we make available. So first, who are the key players? On the PPMD side, these are your PPMD advocacy team members. So Kaylin is our Chief Business Officer. She keeps us all on task and we couldn't function without her. Most of you know me. My name is Rachel. I'm part of the care team at PPMD. We also have Lauren Stanford, who's our Senior Director of Advocacy, and Brian Denger, who's our Community Engagement Coordinator, and you'll hear from a little bit later today. We are really proud of this team that we've brought together, but the truth is we wouldn't be able to do what we do without our community partners. So we are really thrilled to be able to partner with Little Hercules Foundation and the Duchenne Family Assistance Program. And some of those key players are Kelly Maynard, who is the Little Hercules president and founder, Amy Akins, who is their director of government and social programs, and Jen Shumsky, the director of payer relations. All right, so how does PPMD approach access? How are we working together to make this all happen? So part of that is partnering with the community, which is incredibly critical. We advocate at the federal level with things like AdComs and talking to our payer partners, hosting meetings, bringing in all of these key stakeholders, and then even really looking at the state level too. So how can we work with each of our partners from a state-by-state basis to ensure adaptation of positive policies to promote access? We also work really closely with community support, making sure that we're giving you each of these resources and partnering with the clinic teams as well. And then lastly, PPMD for You, if you're not already familiar with it, PPMD for You is a really critical piece for us to be able to communicate with you directly and ensure that you have the ability to get answers to your questions. I also want to take a moment to allow Kelly Maynard to talk a little bit more about her team and how they function and how we work together. Kelly?
Thank you, Rachel. Happy to be with you all today. So as Rachel said, my name is Kelly Maynard, and I am the president and founder and co-founder, president and founder of Little Hercules Foundation and co-founder of the Duchenne Family Assistance Program. And I am lucky to work with such a stellar staff here at Little Hercules Foundation and with our partner organization that we run the Duchenne Family Assistance Program with. Marisa Penrod. I know many of you know her, Doreen Pulgini, Mark Smirtman. So, but for purposes of this webinar, I wanted to highlight some of the staff that you would encounter at Little Hercules Foundation if you filed a request for assistance through our online website and for assistance under the program. So Amy Akins is Director of Government Social Programs. She handles everything Medicare, Medicaid, TRICARE, Social Security, things of that nature, those kinds of programs. She has an extensive professional history of doing this work, but she's also a mom of a boy with Duchenne. Actually, he's a young man with Duchenne. He just recently turned 18. So, and then Jennifer Shumsky is our Director of Payer Relations. She has a history of, she's a nurse, but she also worked for a health plan and utilization management, reviewing policy, approving claims, that sort of thing. And she is also a mom of a young man with Duchenne as well. I have a son who's 16 with Duchenne, and my background before when he was diagnosed was I worked for the Department of Insurance in the business of insurance regulation. And boy, at that time, I did not know how that skill set was going to serve me in my future life living with Duchenne. So, so that's pretty much the staff. There are a couple other I just want to mention that that don't work through the Duchenne Family Assistance Program, and that would be Randy Kleitz. She is our newest addition to our staff, and she's not only an amazing advocate, but she's a rare disease mom. Her son has severe hemophilia, and he survived childhood cancer. And she's also a former Ohio lawmaker. And so I couldn't wait to snatch her up and bring her on board. And she handles a lot of our legislative and policy priorities that come to us through the Family Assistance Program. So we take your experiences, and that informs our engagement with Medicaid, with direct engagement with private health plans, our engagement on Capitol Hill, our engagement with lawmakers and regulators. So, and just the few minutes I have left, Rachel, don't hesitate to interrupt me if I go over time, but the Duchenne Family Assistance Program is a program that is designed to meet needs of the Duchenne community that aren't currently being met or traditionally met from other sources or avenues. And not only do we help you fight any kind of negative coverage decision, we will also attend fair hearings with you to help you through that process. It can be very overwhelming. Amy attends every single DUR and P&T committee meeting, along with Brian Denger is active in that as well. She covers all of those across the country where Duchenne treatments are being clinically reviewed by Medicaid programs. Jen Shumsky would be the one that if your private health insurance denied something, not only a treatment, but we get regularly, probably one of the biggest requests we get is fighting wheelchair denials, because many health plans don't like to cover certain components of power wheelchairs. So and if you're denied a service or something like that, we will help you. We can help you, walk through applying for a waiver and determining eligibility and that sort of thing. But also, in addition to that, we have assistance that's more direct to the individual. And that would be handled by our partners over at Team Joseph. So those are things like travel costs to get to clinic. Many of our families travel out of state to, for their biannual visits and help getting to clinical trials, you name it. There's, anything that might not be covered by insurance. If we fight it and don't get a yes, that's when our partners over at Team Joseph step in. So it's a very holistic program. The only requirement that we have is that you have a confirmed diagnosis of Duchenne. There are no income requirements or maximums. We don't care how much you make because we live this life and we know how expensive care can be and taking care of your family. So that's pretty much it. Did I hit everything or did I miss anything? And how am I doing on time?
I think we're good. I think we're
Okay.
good. I went a little bit quick myself.
Okay.
So I think, Kelly, you provide a really wonderful overview of how our organizations work together. So between PPMD and Team Joseph and Little Hercules, we really hope to essentially wrap our arms around the community and provide you support every step of the way. And I think a part of that too is some of these web-based resources to just get started, because you may or may not need the one-on-one support. Maybe you're an expert at navigating these things, or you just need to figure out where to get started. And so I think that our website is a really nice place to get started. So I do want to emphasize that we do have a landing page on our site that is insurance access and coverage resources. And it really houses lots of different resources in terms of how to navigate the new therapies, medical equipment, and some of the fundamentals of access that help us to learn the language of access, because there's lots of different terms that we have to learn and processes that we have to navigate. So you'll see we just recently revamped this portion of our website. We encourage you to go and check it out. But essentially when you get there, you'll see this overview of the different stages. So the stage 1, where that prescription is written by your doctor and submitted to your insurance. Stage 2, patient, drug company, and prescribing doctor work with insurance to process. And then stage 3, drug is provided to patient. We've got different pieces of information, education, and resources grouped by those stages to help you find what you're looking for. And then over to the right of the screen, you'll see this is a screen grab of some of the Elevidys specific information that we have since uploaded to our website. And I would like to call out specifically, you'll see that red arrow there in the middle, that sample letter of medical necessity for clinicians and doctors. If you do not go to a certified center, if you go to a center where maybe they don't see as many Duchenne patients, or you're just trying to partner together with your clinic and get additional resources into their hands and reduce that burden, I would encourage you to go and check that out and see if it's something that would be helpful. I want to call out PPMD's Brian Denger, who you'll hear from a little bit later, who really put so much time and effort into drafting that sample letter, in addition to Alexis Hazlitt, who's a member of the care team as well. So go check out those resources, see if it answers your questions, and if it doesn't, reach out to us, schedule a PPMD for you with Brian, reach out to Kelly and her team so that we can really just come alongside you and meet you where you are and meet those needs. So I think the next piece that we need to talk about is the role of the clinical team. So we've got our patient advocates, we're all here. We love to fight for you. We love to come alongside you, provide the support that we can. And our community is amazing, but we couldn't do what we do without our doctors and our clinical teams, right? So I want to acknowledge the growing Certified Duchenne Care Center network throughout the US. We've currently got 38 CDCCs throughout the United States, which is really phenomenal, with a goal of bringing certified, comprehensive, coordinated care that meets or exceeds those published standards of care to everyone, no matter where you live. We recognize that there are still care deserts, and that's something that we're actively working to mitigate. But each of these teams at each of these centers is phenomenal. They're multidisciplinary, and it's more than just your neuromuscular doctor. And I think a lot of us know this, but it's really important, I think, that we consider how hard each of these people is working, perhaps in the background, to bring access to us. The nurses, the medical assistants, the research coordinators, the folks who are answering the phones and triaging your MyChart messages. These people are just so critical. And so I think, I want to take a moment to thank each of these people for how hard they work, and acknowledge that while it seems like it's your doctor's name on that prescription, that there's this whole network of people lifting he or she up. And, it's really spectacular to see how a team can come together to promote access and do it so quickly too. All right, with that, I'm going to turn things over to Dr. Aravindhan Veerapandiyan. Dr. Panda, I'll let you introduce yourself and just let me know when you want me to advance through your slides.
Sure, thanks, Rachel. And I'm happy to be here. So you probably see my name is really long. It's Veerapandiyan, right? Like Rachel said, I go with Panda. My patients call me Panda. I used to look like Panda too. Anyway, so I lead the Certified Duchenne Care Center here at Arkansas Children's Hospital in Little Rock, Arkansas. Let's quickly touch base on, so what's happening in the back end on our side from a clinical team? What do we do to get access to our families and boys? Yep. So I think when I talk about access to therapies, right, just a brief, I'm not going to get into details of each one of these. So no, there is work that we do on our institutional side, like in the hospital side, and then with you all, the families and the DMD boys, and then in the community, right? So again, like Rachel pointed out, it's not just one person, it's not just me, it's a whole team of multidisciplinary different doctors, nurses, pharmacists, the people who work on the prior authorization and whatnot. Next, if you click, Rachel. Yeah, from an institutional perspective, what kind of stuff that we do to promote access to make sure we get our boys what they need in terms of any therapies, including the most recently approved one, right? So we had taught discussions from all the way way ahead, like at least a year before it gets approved. We know it's going to come in. So these are different from a hospital leadership perspective that we are having conversations to promote the access, right? And then it comes down to talking to you all, to the boys and the families with this. So talk about what the therapy involves, what are the pros and cons, what are the side effects, and also discuss the logistical challenges that you may have to access the therapies and how can we, as a clinical team, can help you. And also in the decision-making process as well, right? Then the most important one I'm going to touch upon here is how we, outside of my clinical team and our boys and patients, how are we partnering with the community? Of course, advocacy organizations like PPMD, and then we also, the relationship, you have to have a relationship with the payers to make this process smooth. It's hard, but you have to have that. We work on our back end to try our best to have that relationship. I can quote, we had our first gene therapy, the commercial therapy got approved, PA approval within 2 to 3 days of the PA submission, and that happened only because of the relationship that you have with these community stakeholders. Then how we network with the other experts in the field across the globe, across the country and across the globe. And with that, I think I want to highlight one of the work that I'm leading along with PPMD is a consensus statement. You can go to the next slide. Yep. So what is a consensus statement? I think, it's nothing, just a group of experts who have treated boys, who have seen boys with Duchenne and be involved in the clinical trials, come together and just talk about, based on what information we have so far across all the therapies, right? And then we talk about how our opinions, what can we do to come up with statements that can help with these boys accessing the therapy, and not payers determine what they have to give. They're not them dictating the treatment, more of a clinical, the clinical team determines the treatment, right? And it's just, all of us come together, we talk about our opinions, we use like a standard methods to come up with agreements and disagreements, and we publish this consensus statement, which can help with access for therapies. And this is something we just started working on, and we're hoping to get that done soon. So that would also help with access. And with that, I think I'm going to give it back to Rachel, and thank you all.
Thank you. All right, next we want to dig in a little bit more into what your experience might be if you reach out and pursue sort of this case management one-on-one working relationship with PPMD and with Little Hercules, Team Joseph, and that Duchenne Family Assistance Program. So I'm going to toss things over to Brian and Kelly.
Thank you, Rachel. So my work with Kelly begins foundationally with helping families to be able to understand the aspects of a number of different benefit programs. I work with families developing their advocacy skills when they're seeking to enroll for Medicaid, for example, to understand the differences between Medicaid health insurance the waiver programs, home and community-based services, but also I'm very familiar with special education and the differences between a 504 plan and an IEP. My role is more foundational. I help families to understand the different aspects of the program so that they can make more informed decisions about the various programs. One example would be is a lot of families who are covered by commercial insurance have been told that under the Affordable Care Act that they're able to cover a child to age 26. And they don't realize that some commercial plans offer a disability dispensation so that after they turn 26, depending on the type of condition, they may receive the ability to continue insuring them after age 26, 27, 28. My son is 29 and continues to be covered by commercial insurance. So I get recommendations, referrals from advocates within the community, whether it's families or clinicians, regarding some of these components, and help families to put together the various elements so that they can determine what processes, what coverage is important to them, what is going to be beneficial to their family. But there are times when some of that winds up being a dead end for me because the family reaches a denial for coverage for a specific therapy, for a particular form of durable medical equipment. And then I turn and lean on Little Hercules Foundation and work with Kelly to help families to get the denials overturned, to get the services that they need. And she and her team work in a number of different ways to help families more specific when there are those types of obstacles. Kelly?
Yeah, thanks, Brian. Yeah, so whereas, PPMD really has a lot of services for the community as a whole, Brian and I work together. Brian sends a lot of referrals over to us, in addition to many other sources, including, social media. Clinic social workers have been a godsend. They know now to reach out to us when they have a family that's struggling with something and needs some assistance in several areas. Fellow Duchenne organizations, our industry partners, and also Duchenne families. And so I would describe our program as being more one-to-one case management, right? This is based on a family's or a caregiver's or a patient's specific needs that cannot be met elsewhere. And you are assigned, once you apply to our program, you are assigned a case manager that is there specifically for you, and will, work with you to get some resolution to what you need. And some of those things are home modifications, financial support, we have emergency funding. So I want to give you the email address if you want to reach out to us at the Duchenne Family Assistance Program. It's info at Duchenne FAP, Family Assistance Program, so .org. So info at DuchenneFAP.org. And someone will get back to you. DuchenneFAP.org is also our website where you can go and you can see the services that are available to you at no charge. And also what we have on there is a resource finder. So maybe you are, you need help paying a utility bill, or you need to find food banks in your area. This is a really heavily utilized part of our website that families can go to, and you search by your zip code and it'll pull up all the programs near you that that can help, like copay assistance programs, that sort of thing. And then, like I said, cases are assigned based on the expertise, right? But then we get so many cases that, they might be dealing with an insurance denial, but they also, need home modifications that they can't get covered, or they may not have a waiver that will cover them. So in those situations, and that's probably most of our cases, is there are more than one person working it, and we're all working together behind the scenes to make sure that it's smooth, and we're not sending you too many emails. So and then I want to also, I think Jen Shumsky's email might have been incorrect on the previous slide. It's actually jen@littleherculesfoundation.org, Jen with one N. So I just want to, just in case that was wrong. So yeah, if you have any questions, shoot them our way. info@duchennefap.org or kelly@littleherculesfoundation.org.
Thanks, Kelly. I think that this has been really helpful to illustrate sort of what a family member could expect if they come seeking help. And I think a really good example, maybe a week or two back, I was at a car show with my family, and I had an email come in from a mom who said, you know what, I don't know what to do. We just got a denial. Where do we go next? How can you help? And I was like, well, I don't know what to do, but I know who can. And I quickly pulled in Brian, and I pulled in Kelly, and we got her the resources, and Brian pulled her insurance and said, this is what the policy is. And we were able very quickly, late on a Friday evening, to come alongside her and offer that support and figure out how to, help, even if just a little bit. We can't guarantee coverage, but we can certainly do our best to help you fight for your family. And so really grateful for that partnership, and for Kelly and her team, and Marisa and her team, and all of their expertise. So what's next? We've covered a lot in a really short period of time today. And we haven't even scratched the surface. I want to acknowledge we have not even scratched the surface as it pertains to advocating for access. So I can share that this is the first of a monthly webinar series dedicated to access to approved therapies in Duchenne. And obviously right now we're dealing with sort of the after effects of the approval of Elevidys, which is incredibly exciting, but we have 2 more PDUFA dates coming later this year, and a growing space of approved therapies in Duchenne, which is just really incredibly exciting. But it brings lots of questions and lots of issues that we all need to work together to navigate as a community. So that means that each month on the 4th Thursday at 1 p.m. Eastern, we're going to do this again. But we're looking to you as a community to help us understand what your questions are. What are the areas where you need assistance? What do you want us to explain? What do you want us to talk about? Do you want us to talk about, private versus, Medicaid type insurance plans, how to navigate those plans? Do you want us to talk about, combination therapy access and different policies? We want to hear from you. Please, please, please send us your questions. You can shoot us an email at that careteam@parentprojectmd.org email address. Several of us maintain that email inbox, and we'll take a look. And if you have a really specific question, we'll try to get you an answer as soon as possible. If it's a more global question, we'll bring those types of topics to this webinar to really dig in. So please reach out to us. If you had a question in the chat that we were not able to address specifically today, we will follow up with you directly and make sure that we get answers and resources in your hands. So I just want to say thank you to everybody for joining us. I see we've got a ton of people on, and we really hope that you found this to be helpful and productive and answer some of the questions that you have. With that, I see we're pretty much right at time. I want to thank my speakers, Dr. Panda, Kelly, Brian, thank you for being here. And we hope to see you all next month, the 4th Thursday, 1 p.m. Eastern, with more topics as it relates to access. Thank you so much for joining us, everybody. That concludes today's recording.